Good morning, ladies and gentlemen, and welcome to the Board of County Commissioners agenda setting and work session for this Tuesday, September 29, 2020. And if you'd like to join in and listen, the phone number is 360-252-9020. Is it plugged in? And the PIN number is 1234. Is that active?
Yes, sir.
The phone? Okay. I'm John Hutchings, the chair of the board. Also present is Vice Chair Commissioner Ty Menser and Commissioner Gary Edwards. We have the County Manager Ramiro Chavez and Amy Davis, the clerk of the board. We have Megan Porter, our PIO in the house, and we've got Shelley Slaughter, Director of Public Health and Social Services. And whom else am I missing, Ramiro? I don't see.
I think I have Dr. Demiana Eldemalek.
Yes.
We have Kurt Harding, Matt Unselman, Paula Cracknell, Kelly Myrno, Heidi Thompson, Kerry Hibden, Craig Season, Mark Moffett, and I think I cover all for now.
Ariel Benson.
Ariel Benson, I'm sorry. Yeah, right there. Thank you.
I tell you what, this is an all-star cast today. Welcome, everybody. And we're going to begin with a COVID-19 update. So I'll turn it right over to Director Slaughter.
Good morning, Commissioners.
Good morning.
I'm going to share the data from the last week and as of yesterday, the latest available data that we have. In Washington State, there's been 86,638 confirmed cases of COVID-19 with 2,100 deaths. Here in Thurston County, our numbers as of yesterday stand at 1,224 with 74 new cases in the last week. To date, we've had 17 people in Thurston County unfortunately die. 71% of those that died had underlying conditions. There's been one new death in the last week. 92 have been hospitalized in the course of their illness. 13 have been hospitalized in the last week. 990 have been released from public health monitoring, with 33 released in the last week. Our hospital capacity currently is 75.4% occupied beds, with 2% of those occupied by COVID positive patients, for a current total of 10 among our two hospitals. Our testing to date, we've done 43,000 here in Thurston County. The current positivity rate is 1.7%. I also want to share that we are increasing our community-based testing options for anyone that is symptomatic of COVID-19. We're offering free COVID-19 testing throughout Thurston County with a testing event today in Rochester at the nonprofit organization, Rochester Organization of Families, also known as ROOF, from 11 to 2 today. So anyone who's interested in the Rochester area or anywhere anywhere in Thurston County can go and get free COVID testing if they feel symptomatic. And people should please stay home if they feel ill upon getting tested until they have that result or have been released. And encouraging people to please get a flu shot. And with that, I will pass it over to Dr. Abdelmalek to share more.
Good morning, Commissioners. I'm Demiana Abdelmalek, Health Officer. This has been a fairly eventful week since we last met. Last Wednesday, September 23rd, I made the recommendation that our schools begin a slow, phased-in approach to some in-person learning, prioritizing students with the highest needs. This would be phased in accordance with existing guidance from the Department of Health, both through their decision framework and additional guidance, OSPI, and the CDC. We as a county throughout even when our cases had their uptick in July and our kind of persistent elevated transmission rates through August, and the beginning of September, we've been in that moderate transmission range. And so with all of this guidance and what we're learning, both about how transmission occurs in our county, as well as our state and around our country, I'm recommending just a slow, phased-in approach to in-person learning. We have put in place a communication plan with our school superintendents throughout the district that offers clear guidance on how we're going to identify cases, support people in staying home when they're sick, and if they end up coming to school when they are sick, what the process is for that, as well as for contact tracing and case investigations in the school setting. So that plan is in place and we have it actually available on our website. We have experienced a moderate uptick in the last few days. We're watching it very carefully. When I look through how people are getting COVID in most recent days, a lot of it has to do with travel, which hadn't been a significant factor in preceding weeks, particularly out of state travel is what we're seeing. We're also seeing that there's a lot of household spread between friends and family, meaning that for approximately half of the folks that we have that we know who've tested positive in the last week, approximately half of those, we know a close contact who is a case. So it's that while there is some community spread where we don't know where people are getting it, about half we know an individual person who may have been a close contact and spread it. So that while we're watching the situation with the rising case counts very closely, at this point, it's really limited to specific activities like travel and close contact with friends and family. We look forward so the other piece that I want to share with all of you is our numbers. So because our numbers get averaged over a 2-week period, our most recent transmission rates are 22 per 100,000 over the past 14 days as of today. However, because of this trend that we're seeing in individual cases at the county level, my suspicion is that we are likely still in that moderate transmission range, and I would need to see several weeks of data to determine whether or not we're out of that range. An additional piece to why our cases per 100,000 over 14 days might be a little lower than we expected was that during the smoke, one of our major testing sites, our drive-through testing site, was closed. And so that also has an impact on our case counts. So we're watching both individual trends, county trends, and our access to testing going forward to monitor the pandemic situation here in our county. And I'm happy to take any questions.
All right, my seatmates, Mr. Edwards, questions? Go ahead.
The testing that you're using now, and specifically you're talking about doing some free testing down in the Rochester area, how long does that take for a citizen to get their test back when they participate?
Right now, our turnaround times are in the 48 to 72 hour range. These are the molecular PCR tests that we're performing.
Oh, okay, thank you.
What's the molecular test mean? Is that up the nose or down the throat? So that's in the nose, but the molecular test refers to tests that test for the genetic material of the virus. The point of care tests test our antigen tests, which test for viral proteins, and those are the ones that have a quicker turnaround time, but have a different sensitivity and specificity. The gold standard is the molecular test.
Oh, okay, thank you, Doctor. Commissioner Menser?
I don't really have any question. My comment is that it's kind of feels like we're right on that line of that, 24 per 100,000 over 2 weeks. And as we go above and below it, it makes it, I know, difficult. I'd hate to be in the position of the school administration that, trying to figure out what's the right way, because there's so much effort involved in reconfiguring the learning models and the schedules, but yet, okay, for 2 weeks we're good, but then we're so close that the next 2 weeks we might not be good. And how do you manage that over a medium term? I just really feel for the school districts and the teachers and the students that are struggling with this, like we all are. But in my household, it's all about the schools and the teachers. So I'm just it's a difficult situation. Thank you for help guiding them through the best you can.
Thank you. And for that, regarding that comment, it is very difficult. And I feel for the school districts, everybody involved, because in addition to the science that's being put out, the medical data, in the 24 per 100,000, there's also 3 or 4 different associations or unions involved. We want to go back. We don't want to go back. You're not going to make us go back. We have to go back. And they're doing a lot of arm wrestling. It's creating a tremendous amount of stress at the principal level, all the way down to the paraeducator. It seems like the parents and the kids are the only ones that don't get a say. So it's really a tough thing for them to deal with. Doc, I have a question regarding what we're hearing as of yesterday and today is that the Corona-19 test is 20% inaccurate. Are you hearing that too? I mean, you must be hearing that as well. That 20% of the time you might be told you don't have it, but you do, or vice versa.
So false negatives are a problem with some of our COVID-19 testing. It is more so with the antigen test, so the protein test, than the PCR. No test, even the tests that get run in the hospital routinely, is 100% accurate. And so the way we've thought about it, taking that into account, both at the state level and at the county level, is that for the antigen tests, where the rate of for the antigen test, there are very few false positives and a significant number of false negatives. It depends on the specific test when you look through the data. So as these become more common, when people have symptoms consistent with COVID and there isn't another explanation for it, the recommendation is either to repeat with the molecular PCR test, or if that's not possible, we treat. If that person has had contact with somebody who's had COVID in the last 14 days, we treat them like a COVID case because that's likely what it is. So that's how we're mitigating spread and using the testing to help us, but not having but not letting us just a test get in the way of our clinical knowledge and our clinical judgment.
Okay. I'm going to pretend I understood 100% of everything you said. Just because it makes me look smarter if I pretend I understood it all. But thank you, Doc. My other question is regarding the flu, but it is COVID related. Of course, it's being reported, and you have mentioned it in the past, that it's very important for people to get their flu vaccine. Don't be a vaccine denier. Because if you get the flu, which is likely, your immune system is compromised even further, which might make you more susceptible to COVID-19, and or vice versa. And you don't want to compound that medical issue in your own system. And we're still experiencing somewhat of a shortage of flu shots, certain type of flu shot. And again, you've explained that in the past when I've asked, and I don't remember it. But there's one for a certain specified age group, and then another generic one. And there's a shortage of the higher dose or whatever it's called. I'm not sure what it's called. Still encouraging people to get their flu shot and not wait till October, November, but to get it early.
So yes, we are recommending that folks get their flu shot in September, October. However, you know, it's never too late to get your flu shot, but getting it early is going to give you the maximum amount of protection. A flu shot is better than no flu shot, but the appropriate flu shot that triggers a stronger immune response, if you're in the category of people who need it, is best practice. So that would be folks over age 65.
So if let's say for the sake of argument, I'm in that protected group and I have that shot, I've already had that a week ago, and it doesn't hurt anymore now. Can you take, if they're out of the higher age group shot or vaccination, can you get the lower one and then they get the other one? Can you compound them or not? Is that advisable?
You know, I don't actually know the answer to that, but I can definitely get back to you. I haven't seen it done in practice. I haven't seen it done, but I can get back to you on the specifics.
Would you? I appreciate it. My wife and I are having that discussion at home. She went in to get her upper age one and they're out. And I said, well, I don't know if you can get the lower age one first and get the next. I have no idea, but I was thinking the same thing. One is better than none, but she's waiting. It's supposed to be this week. Anyway, thank you, doctor. Any other questions, commissioners? Romero,
No, sir.
any questions?
No, sir.
Or Shelley? Okay. Thank you very much, doctor. Thank you much, Shelley.
Thank you.
Now we're moving into homeless strategies with our very own Keely Marino. Hey, good morning, Keely.
Good morning. Keely Marino with Public Health and Social Services. I just have a brief update for you today. Reporting on the Eviction Prevention and Rental Assistance Program that's being facilitated by the Community Action Council. They have, up to this day, 670 appointments so far. And based on those numbers and their funding for this particular program, they're forecasting that they will be closing appointments by November 12th to make sure that everyone with an appointment is served. They have served 238 households so far. That's 485 future months paid for and 229 back months paid for, to the tune of $690,846. So they are cooking and making sure that folks that need that help are getting access to those funds. In other news, I did sit in on a rulemaking listening session with the Department of Enterprise Services, where they are coming up with a draft rule around parking on Deschutes Parkway. As of this point, there are no RVs that are parking on Deschutes Parkway. There may be a few vehicles, but at this time, the RVs are not parking there. So we will continue that conversation this week for listening session part 2. Yet related, on average at Ensign Road, there are 42 to 48 vehicles that are parked there on a daily basis. And I connect with Teal Russell, the City of Olympia's homeless coordinator, every Tuesday prior to the session to just make sure that I have any up-to-date information from City of Olympia. And from what I understand, emergency vehicles have now rerouted off of Ensign Road, adding 4 minutes to every transport to the emergency department. And I'm sure that you can feel the gravity of that choice for emergency vehicles to be rerouted to the emergency department. I'm hoping to join Teal Russell today up in Pierce County to look at their stability site and some of their tiny home structures to just kind of see what they're doing up there. And meeting prior to that to discuss the Ensign Road situation. And that is what I have for today.
Thank you. Are there any questions of Keely, Commissioner Edwards, anything?
No, sir.
Commissioner Minster?
No questions. Romero and I had a meeting on Friday, I want to say, with the new CEO at Providence. And I thought it was a good meeting. He mentioned Ensign Road. He didn't get as specific as you just got, which I'm kind of surprised given the seriousness of what you just described. But he wants to work with us, obviously. It sounded to me like it would be a good, productive, it's probably somebody that you're going to, if you haven't met him already, you will. I think we are going to try to forge a partnership so that we can work on these things together.
I'm looking for a reference here so I could ask Keely about it. In the Olympian, it was reported that here it comes. Hang on. 5 tiny homes at the Union Gospel Mission are now open.
Yes, yes.
And there was a partnership along with Olympia's Rotary Club. And how many homes are there? There's 5. How many does that serve? 5 or 10?
I think it would serve 5. They're single, I believe, single units. And there are 5, yes.
And it's right down there at downtown Franklin at the Union Gospel.
They're in the back parking lot by the Connex containers.
I'm looking at the picture from the 27th from Sunday. That's a beautiful thing.
Yes, it's excellent. I was able to attend the ribbon cutting ceremony at the invitation of Skip, who is the director over there at Union Gospel Mission, and it was a great day. It was a sweet turnout where everyone was physically distanced and masked up, but wanted to support Union Gospel Mission in this enterprise. Very exciting.
It is. They're 8-foot by 12-foot homes, constructed primarily by students in the Youth Build program. That is just so doggone cool. Okay.
Hey, Keely, just a quick question. Is that where we have our hygiene trailer?
No. Our hygiene trailer will be placed at First Christian Church.
Okay, thank you.
So that's on Franklin Street.
And Keely, are you later on this morning towards the end of this session, we're talking about the point in time. Are you going to be around for that too?
I will be, indeed.
Okay. All right. Well, thank you very kindly for joining us this morning. We'll catch up at the end of about an hour and a half. So.
Sounds great. Thank you.
Thank you. We are now going to review our agenda for this afternoon, Tuesday, September 29th, 2020. We'll call the meeting to order at 2 o'clock and the Pledge of Allegiance to be led by Vice Chair Commissioner Menser. Then we'll do the approval of the minutes, the agenda for today's agenda, and then the minutes from last week. Then there's a presentation regarding emergency services.
Yeah, thank you, commissioners. You reviewed this agenda item last week. This is for the board to consider passing a proclamation declaring the week of October 12, 2020 as the Thurston County Flood Awardness Week. I believe you have the opportunity to review the agenda. Kurt Harding gave you a perspective last week about this particular item. So if you have any questions, he's available for you this morning.
Good morning, Kurt. It looks like you have a terrible suntan. Oh, no, that's the sun coming through the blinds. Is that it?
Yes.
Okay.
Hey, here we have 7 more days of sun.
Yes. Commissioners, any questions of Kurt or comments regarding the proclamation?
No, sir.
Oh, okay. Well, we're going to read that and look forward to doing that this morning. Thank you. Next is the opportunity for the public to address the board.
Yeah, you may probably have some public testimony this afternoon. You have received a couple of email correspondence from Mr. Pettit, so I will assume that he will be providing testimony this afternoon related to those items. So,
okay. Commissioners, aware of anything coming up in public comment?
No.
Nope. Then we hit the county manager's report. Any follow-up on citizens?
I don't have any specific follow-up.
All righty then. Then we get into agenda item number 3, and that's the consent item. And we only have A, it looks like, and that is the voucher list. Agenda item number 4 is community planning and economic development, setting a public hearing for the open space tax program applications.
Thank you, commissioners. You have reviewed this item a couple of occasions, one in a formal briefing as well as last week. And this is related to 4 applications for you to consider putting in an open space tax program that is managed by the Board of County Commissioners. 2 of those applications were used to be part of the assessors open space program, and those two properties no longer qualify the requirements of the assessor's open space. As a result, they have been brought back for your consideration to include those two. And you have two additional new applications. And this particular item is for you to consider in setting the public hearing for August 19, 2020, before you can consider taking a formal action and bringing those four properties into the open space program.
And that'll be for October 20th.
Yes, I'm sorry. That's October 20, 2020.
Okay, thank you.
The public Planning Commission held a public hearing on August 19. I was misreading my notes. Thank
Got
you
it.
for the clarification.
Commissioners, any questions or comments on that?
No.
Nope. Okay.
I had
Agenda item number-
questions. I got
Yeah,
them
go ahead,
answered.
Ty.
Oh, I said I had questions and I got them answered on my own with the assessor's office. So I'm good.
Good, okay. Agenda item number 5 is Public Works, setting a public hearing for the updated parks, open space, and trails, or the post plan.
Yeah, you also reviewed this item, commissioners, and also you had a briefing. And excuse me, and this is for you to set a public hearing to receive public testimony related to the proposed parks, open space, and trails, also known as the post plan. The post plan is an update of the 2013 Parks, Recreations, Trails, and Natural Resources Preservation Plan, and acts as a guiding program management document for the county's parks and trail system. An adopting post plan allows for the receipt of grants to make improvements to the parks and trail systems to ensure adequate recreation land is available to serve future needs based on our growth projections. This plan, just to clarify, is a guiding principle as to how we're going to be implementing recreation strategies in the future, and does not have any financial obligations to the county at this point. And Carrie Hibden is here to answer any questions you may have related to this request. And again, this request is for you to consider setting a public hearing for October 27, 2020, 3 in the afternoon in this room.
I have a question, but it's not related to this item of Carrie. And I don't remember if it was the end of September or end of October is his last day.
Well, I think this public hearing, if the board decides to set the public hearing, it will be his last public hearing as a public works employee.
There, you gave me my answer. Thank you. Commissioners, any questions of Carrie on the post plan?
No questions, but a comment. I'd like to have Carrie, have him think about maybe extending that date. But
Okay.
Second.
Extending the date of a public hearing, extending the date of retirement.
date of retirement.
Yeah, I second that motion. That was 5A. 5B on the agenda is the ordinance regarding the role of special assessment for the Black Lake Special District.
This has been an item that you have discussed on many occasions. And this is for your consideration to take the action related to the request from the Black Lake Special Use District, and you authorizing raising charges for them to perform a water quality control on Black Lake. There has been over the last few weeks conversations whether the Black Lake Special Use District was formed correctly. There has been arguments in terms of whether this is a flood control district, not a water quality control district. I believe those questions have been addressed in a couple of occasions. The latest issues that have been brought up to your attention via emails is whether this action of the board requires a SEPA environmental review. And under Washington Administrative Code 197-11-800, and I have, just to make sure that I'm not providing a legal perspective on this, I have checked with Elizabeth just to make sure that we cross all the T's and dot all the I's for you. And this particular WAC, again, is the 197-11-800, talks about the categorically exemptions for SEPA process. Under this particular criteria, on section 14, it starts describing activities of agencies to following administrative, fiscal, and personnel activities shall be exempt. And under item 14, item B, it specifically states the assessment and collection of taxes. So your action that you may be considered taking related to this matter is you authorizing the increase in rates and charges to this particular district. You're not authorizing a project because the project itself needs to meet the environmental requirements by the special use district in this case. So your action you may consider taking and authorizing the rates of charges is exempt from any SEPA environmental review. Just want to circle back on that. Also this morning, we'd receive an email from Mr. Petter, which he included an audio clip where he states that perhaps the assessment of $103,000 they may be considered on an annual basis is wrong in terms of the amount. I have forwarded that email to staff, and I think Paula Cracknell is going to give it a shot to address this particular item for you.
Okay.
Good morning, Commissioners.
Good morning, Paula.
The $103,000 is a separate assessment that is solely for this bond that Black Lake Special District is asking for. What Lake Stency was referring to were their normal rates and charges that they charge to all ratepayers within the Black Lake Special District, and their promise to their members, which is not part of this action agenda, is that they will have a reduction in the normal rates and charges that they give to the Black Lake Special District members. So that's a separate item that does not apply to the $103,000 per year, which you will be considering today.
All right, Commissioners, any questions of Paula?
Yes.
Go ahead, Commissioner.
How much are those ratepayers paying now? I mean, I know they're asking for 103 per year, but what is that above and beyond what they're currently paying?
So the median, I don't have the exact amount, but in the audio clip that that was sent over, Lake stated that it would be an average of about $460 extra. But that is also including the fish and wildlife parcels in Kennydale, which will have a much higher rate than the lakefront owners themselves.
And what's that total amount that's collected now, I guess, then?
Their current rates and structures right now, I don't have that information in front of me. But I can.
Paula, maybe you can bring that information this afternoon when you present the items, if the board would like to decide to have it on the agenda.
Absolutely.
Yeah.
Yeah, will it be you, Paula, here, or is Tim coming too?
Tim is going to be there, but I will chime in as well.
Okay, great, thank you. Commissioner Menser, any questions or comments? You've done extensive research on this.
Well, I just tried to address a lot of the questions, and I'm, the thing that I think is, Ramiro kind of hit on it, but I think it's worth repeating, is that our action is to permit the special district to assess the financing essentially for water quality activities. And we're not, I mean, we know what those are probably going to be because they've told us, but that's not our decision. What they do, what quality they've formed to take these actions, we're authorizing them just as kind of, in a sense, a formality, because we're the ones that have to do the mechanics of the tax collection. But it's their decision. They've elected their commissioners, their special district commissioners. They've made decisions. They've calculated. They've figured out what water quality activities they can do. They've researched it. They've consulted with our staff on that. They've worked with Department of Ecology. So our action is very, very limited here. But I went beyond all that to sort of answer some of the other questions, and I'll say more about it today when we do our form. Assuming it goes on today's agenda, I'll comment more extensively at that point.
Thank you, Paula, but I'm going to respectfully ask that we keep this on the agenda for today. But I leave it open to my seatmates. Are you okay with keeping it on?
I have to say that from my perspective, I don't like to have doubt when we're doing something. And above and beyond that, I'm worried that this is a Band-Aid approach to solving a serious water quality issue. And when we take the Band-Aid off, it's still going to be not solved. And I wonder if there isn't a better process that we could put in place. And that could be including the state in this somehow. I mean, the claim is that it's a state waters. I don't understand why we can't come up with something rather than a Band-Aid. I'd rather do a better job of water quality. Now, I don't know what that is at this point. I know this has been kicked around a lot by those Black Lake residents out there. But it always worries me when we go into something and don't have it down pat. And I have to compliment Commissioner Menser for all the work that he did on this. Very informative. It's just I've still got questions, that's all.
Go ahead, Ty.
Just make the comment. I think Paula has given some information that kind of shows the complexity of a long-term solution to this problem. But one of the solutions for sure is greater attention to septic management, and a prior board eliminated the funding for implementation of the septic management plan, and I think you voted for that. So I think that's in my opinion, that's contributed to the situation we're in now, where we have to resort to something like a Band-Aid treatment of the alum. But it is an accepted practice, and it can be done safely, is my understanding, which was very important for me to understand better. So I think we are where we are, but I do think I would join you wholeheartedly in refunding the septic management program that we put together and getting to work on some of the underlying problems, including stormwater. But that means land use regulation and things that you don't tend to like in other contexts. So we're going to have, it's one or the other. We got to work on these problems or not.
So are you in favor of keeping it on the agenda for today, Ty?
Yes.
And Gary?
No, I'm not in favor of it, but it's a majority rule situation, so.
And I'm going to ask the question of Romero again. What kind of time frame? Are we under a different time frame or a specific time frame?
Well, the time frame is if you the board decides to take an action, we need to give enough time to the assessor to put this in place when the property tax assessments will go out in January 1st. So there's still some time if the board wants to delay this for a week or so.
Okay.
But at least from my point of view, there has been a lot of questions related to this. I think we have made an effort, including Commissioner Mercer, to address all those questions. At this point, the information that Commissioner Edwards requested, I believe we have provided in the past. We'll make sure that we bring that information this afternoon as well, just for make sure the public understand the nuances as to what the existing rates are and what will be the rates after this particular action is taking place. So, but it's really up to the board whether they'd like to delay it. And even it's up to the board whether they'd like to consider not taking any action. So your options are wide open.
Well, in looking at or listening to Commissioner Edwards' questions about what are the current rates versus the new one, what's the disparate amount or the difference between the two and such, we can get that information. Again, I think it's been provided in the past, but we can get it again this afternoon. But I don't think that's part and parcel of what the overall ordinance is addressing. And so I'm in favor of keeping it on the agenda for today. We'll get it done.
Okay. Thank you.
Thank you, Paul.
Mr. Chair, could I get a comment
Yes, sir.
in there?
Yeah.
My concern is that we're going to create a tax burden, a fee burden, whatever you want to call it, for the lake residents, then we're going to look around and see, well, we didn't do enough. Then we're going to add something else, and that could be a septic thing that's been kicked around for quite a few years. I have not seen the science that shows that properly functioning septic tanks are a problem. I know at Lawrence Lake, we went through something very similar to this, and we ended up hiring an engineering firm. We created a lake management district, and we hired an engineering firm. They reviewed everything that was contributing to the lake, and they found that septics were not a contributing factor to that problem. And we've had all these treatments, weed harvesting, alum treatments, different things that we've done as well. And it isn't the septic systems that are operating properly. And it's easy enough to test and find which ones are and which ones aren't. But in the end, those that are away from the lake have plenty of Mother Nature's properties to work through, I guess, to make sure that the little enzymes do their work. And that has not been proven to be one of the water quality issues. As a general rule, the issues come more from a nutrient situation where a lot of these lakes were used as sawmill ponds, a lot of organic material in the form of sawdust or wood slabs, that type of thing, were put into the lakes. And that is where the problem is more than the septic issue, in my estimation. Now, I'm not saying that science couldn't change my mind on that particular deal, but I'm just afraid if we assess a cost to these lake property owners and then come back and try to assess something that's maybe less scientific, we're going to really end up doing a double impact to some people. So I'm just not sure this has been thought out adequately. That's all. I just let it go at that. Thank you.
Right. Thank you. That takes us to agenda item number 6A, which is the budget amendment number 5, appropriating additional COVID funding.
Yeah, commissioners, for your consideration is this item is for you to approve a resolution approving the budget amendment number 5 for the 2019-2020 biennial budget. This is mainly related to expenditure authority related to the CARES money that have come, additional CARES money that have come available to the county. Robin Campbell is going to walk you through the details of this item.
So this is to appropriate, as Romero said, the additional funding that the county has received for public health and for broader purposes. It also has two items. One is a slight correction of the previous CARES allocation. The funding went to central services, and it really needed to be in IT department. And then the last thing in this amendment is an increase for TCOM. It's unrelated to COVID, but their tax increase passed in the election, and we need to increase the revenue and appropriation for the county to be able to pass that through. So really, this amendment addresses additional COVID funding and an increase for TCOM.
Okay. Any questions of Robin on this issue?
Robin, just for the public's perspective, can you address the public notice related to this item the board may consider taking today?
Yes. So state law requires the county for a budget amendment to publish notice of when the board will take action. So that we've done that each week in the last 2 weeks. There's been notice published in our official paper. There's been the notice on our website, and a public hearing on a budget amendment is not required.
Thank you.
Okay, any questions, commissioners? Go ahead, Ty.
I read in a letter that I got yesterday that we're having a secret meeting today about this. Is this that secret meeting?
There are no secret meetings planned around the budget amendment.
And we're live streamed right now, is that right?
Yes.
Because I had not, just for the record, I have not attended any other meetings that beyond today. So I wasn't sure where that was coming from, but
Well, that surprised me when you said that.
We did talk about this amendment each week for the last 2 weeks. So let you know that this would be coming at your agenda setting meetings. So we have announced it. We've published it in the paper. What we're not doing is holding a public hearing. And that may be a misconception on the part of a citizen that we're required to have a public hearing. We're not.
And also any budget conversations the board had, not just on this matter, and any other matters related to the budget has been live streamed. It's been published. The room 280 has been open for whomever wants to come and be present. So there is no secret meetings leading to this particular action that you may be considered this afternoon.
Or any action that I'm aware of. I'm not aware of secret meetings on any topic.
all right, I know. So I understand the adjustment for the previous money and the TCOM, but as far as the additional funding, the resolution is not in front of me, I don't think. So how specific is that about the decisions the board made in terms of the allocate? How specific is the resolution that we're going to be adopting?
The resolution is high level, but it has the detailed line items behind it.
And we will have that, is that in our packet or we'll have it before this afternoon to look at?
You'll have it this afternoon.
Okay.
Is it in the attachment?
It's available now.
Okay, well, I'll track it down. Conceptually, no problem. I just like to see the wording that is in there. I haven't grabbed it yet, looked at it.
Commissioner, are you looking for the resolution?
Yes,
Yeah, I'll make a copy here in the break.
thanks.
Yeah.
I believe it's our standard amendment resolution.
Right.
Is it in the attachment put together by Olivia?
It would be.
Okay. We can get that off the computer. Commissioner Edwards, did you have any questions?
Yes, I don't know how closely it's connected, but have we got our sales tax report yet?
No, I have not seen that yet, Commissioner. I'll check again this morning.
Okay, thank you.
Ty, were you done?
Yep.
Okay. And you said there was a group or a citizen or citizens that were saying that we had secret meetings, budget meetings?
There was a letter yesterday. I thought it went to all of us.
Yeah, I did.
All right. I read it yesterday morning.
Okay.
Questioning basically saying that the budget amendment 5 was about rescinding the budget decisions from before, and it looks like we're having a secret meeting today about it. And I didn't know anything about any of that. I assumed that was about this item because there's no other actions that I'm aware of that we're planning to take. So I just wanted to clarify that.
Wow. Okay. All right. Thank you. 6B, repeal biennial budget process for Thurston County.
Yeah, this is, Commissioners, for your consideration, following up the board's direction to move from the biennial budget and have an annual budget for 2021. And this particular item just formalizes that particular direction.
Yeah. Any questions, commissioners, on this topic?
No, sir.
No.
Okay. And again, this is live streamed and open. 6C, budget and fiscal principles.
Yeah, this is another item the board has discussed in a few occasions. It is related back to the December 15, 2008 resolution in which the board then passed the budget principles and budget and fiscal principles. The board has taken the time to review those principles and revise those currently. In this particular resolution, I believe formalizes the board's decision related to those budget principles. And Robin is here to answer any questions.
Any questions, commissioners?
No, sir.
Okay. Thank you. 6D, the resolution defining the role of the county manager.
Yeah, thank you, commissioners. You have reviewed this item as well. This particular item is the intent to clearly define the role of the county manager in relation to the Board of County Commissioners and the individual commissioners. I'm not going to be reading the whole Exhibit A, but I'd be more than happy to answer any questions. You also received some correspondence from a citizen related to this item, and this is for your consideration. Let me just read one portion of the resolution, and I think it's important to point out. This resolution does not supersede any applicable Washington state laws governing the role, authority, and responsibility of the Board of County Commissioners and individual commissioners. And that is important to note, that this particular item does not attempt to supersede any role, any responsibility, and any duty that you have as a Board of County Commissioners as well as an individual commissioners. If you have any questions, I'll be more than happy to answer.
Any questions? Commissioner Menzer.
I just want to comment. I got a citizen letter suggesting that I was going to be rubber stamp, or we were going to be rubber stamping something that the county manager came up with. And I just want that citizen to be aware that I asked for portions of this policy. I went back and forth with numerous revisions with the county manager and made some changes. So in no sense am I rubber stamping anything. This is something that I feel is overdue in Thurston County. Municipalities have it. I looked at several different municipal and other county policies that were analogous. So that's a misconception that the citizen who wrote to me or to us has.
Thank you, Commissioners. Also, that applies perhaps to a larger context. Any item that comes before you, the last thing that I want to do is surprise you with an item at 2 o'clock in the afternoon every Tuesday. I believe that these meetings, you have the opportunity to answer any questions, to ask any questions, and we are bound to provide those answers to you before you take any legislative action. This particular item, I believe I have shared with a couple of draft options with each commissioner, and each commissioner has provided feedback related to this item. So I am not coming to you this afternoon with a brand new document and expect you to approve it without you having the opportunity to review. That will be outside of my purview. And also, you have the option to say no and something that you be surprised. And I hope that is never the case.
Commissioner Edwards?
Well, I guess the only thing I'd comment on is the fact that, the majority rules on this board, that means any two commissioners at this point in time. And so whatever it refers to, if somebody's worried about it, two commissioners can make a decision at any time moving along. So I don't see any problem with it.
You don't see any issue with this resolution?
No.
Okay. And when this was put forth, I provided my feedback to Romero, and I was looking at from the scant eye, the scrutinizing eye of, is this usurping any authority of an independently elected official? And did not see that. And again, worked with the county manager with some recommendations and such, and they've been addressed. And the citizen that thinks we're rubber stamping is the same one that thinks we're having secret meetings routinely and such. And so I discount that completely. So I'm okay with this as well. Anything further on that? No. All right.
Sir.
Then 6E is when we report back on our boards and committees and such. And then 6F is the county manager reviewing the Board of County Commissioner schedules and reminding us today is his birthday. And then 6G is adjournment. That takes care of today's agenda.
Thank you for that, Commissioner.
We're going to move quickly into the agenda for October 6th, which is next Tuesday. Is one of my seatmates missing one? Because I received two. I don't know if they're identical or not. I'm going to presume they're identical. Somebody missing one, a copy?
No, you don't have the Tuesday, October 6th agenda?
I do. I have two of them.
Oh,
So I'm wondering if somebody's missing one.
hopefully not.
Okay. So we'll call the meeting to order next Tuesday at 2 o'clock. Pledge of Allegiance to be led by Commissioner Edwards, and then the approval of the agenda and the minutes from today, and then an opportunity for the public to address the board, and then the county manager's update. Then we get right into agenda item number 3, the consent items A, B, and C. The first one is the sheriff, sole source purchase from Safe Restraints Incorporated.
Yeah, thank you, Commissioners. Under the procurement policy, there is an opportunity for the board to waive any bidding requirements, and you can probably move to approve a sole source purchase. This particular item meets the intent. The Sheriff's Office is requesting approval to purchase 8, what it calls quote unquote, the RAP. The RAP is a safe restraint system designed to protect individuals and deputies by reducing the possibility of injury and death. This system has safety features such as a locking shoulder harness, leg restraint, and ankle strap. This particular item has been reviewed by the internal auditor and has met the requirements of a sole source purchase. This particular item has an amount of approximately $11,400, and I believe the Sheriff's Office is within their budget in 2020. And I believe Heidi Thompson from the Sheriff's Office is here if you have any questions related to this item.
And Captain Gordon Phillips is with us as well. Any questions of Captain? Captain? Do you have anything to add, Gordon?
Can you hear me? This is a brand new microphone and camera. Good to go?
Yeah.
Yeah.
Okay. Really, county managers spoke about everything that I was going to. There's a couple more things. I started looking into this product back in July. Got some good reviews. Like the county manager said, went through legal, made sure there was no issues there. But I did find out that 53 agencies in Washington State have already started using this product several years ago. 3 local agencies in Thurston County use the product. That's Olympia, Lacey, and Tumwater. So this product, over 2 years, I want to buy 15 of these, 8 this year, 7 next year. And the plan for distribution would be to my patrol sergeants and some of my defensive tactic instructors.
All right, so the 11,400 is for 8 of them? Captain?
Correct.
Okay. Any commissioner have a question of the captain?
I don't think I have a question as much as maybe he can just answer in the affirmative if it's true. This product could help us deal with unruly arrests and possibly come out with a less than fatal situation, I guess, right?
You are correct. Then that's the part I really liked about this product was if somebody's being combative, unruly, we can put this product on them. It's at least 2-person, 3-person. So that's why I'm thinking supervisors would have this in their car. But, 2 commissioners sitting there understand you put somebody in the back seat, they're already unruly. They kick out windows. They hit their head on the partition, causing injury to themselves. We don't need that. This product will help prevent that. And plus, the way the arms are still, fire department medics would still be able to check vitals, introduce IVs, whatever they need. The person can be transported to the hospital, and the medical staff there can also have access to the individual's limbs or arms.
Thank you.
Correct me if I'm wrong, it sounds like this is not sort of an upgrade or a replacement for something else. This is kind of a new a new product, new piece of equipment that you sort of don't have an equivalent of now?
Correct.
Okay. And then is that like, how did you arrive at the number that you think you are going to need? You said 15 over the next couple of years.
Yeah, I have 11 sergeants that they don't always work. So I just want to make sure my supervisors had a product, because if somebody's unruly, they're hearing that on the radio and they usually head in that direction. Shortly after I learned about this product, we had an incident where a person already used their head to bash out a side window of a patrol car and reached out to Olympia, and Olympia was kind enough to bring their wrap out to us.
Gordon, I have two questions. Is kind of following up on what Commissioner Renter just asked about why you're doing 8. Are you doing 8 instead of 15 also out of budget concerns?
Yes.
So optimally, you'd have all 15.
Optimally, my initial proposal to the administration was 15. And
so that'd be about,
budget restraints, I could only get 8.
So that'd be about $24,000.
Give or take.
Ish, okay. Now, I'm not familiar with the wrap. Can you describe it for me, please?
What you do, there's a harness that goes over the chest. Usually, if you're able to get the person down to the ground safely and handcuff them, you put there's a strap that goes around their ankles and keeps them from kicking you. And then you're able to put a harness over their shoulders and secure that. Then the actual wrap goes around the legs, and there's a strap between the legs and the chest. So the person's in a seated position, upright seated position, but they're unable to, kick themselves use their feet as a weapon on deputies or the car. But it is a nice, I've seen videos of it. We had some instruction from the manufacturer. They provide that for free internet, but it's a live demo and instruction, and that will continue also. But the person's in an upright seated position. They're held by the strap between their legs and their upper body. So they're not, trying to fight for air. They're not trying to, they're just sitting there with a strap that's holding them up. So they're not straining their abdomen or anything.
So many, many years ago, of course, a combative individual would be hogtied, and this is not hogtied.
No. We had hobbles, but we tried to make do with hobbles, but people still are able to get out of the hobbles and kick the windows or kick the deputy as they're being put into the back seat.
Okay, and one final question, is the harness, is it cloth or what's it made of?
It's more of a leather material.
Okay. Very cool. Thank you, Captain. Nice to see you again.
Good to see you.
Mr. Hutch, could I get one more comment, please?
Okay.
On this particular issue, Captain, would you think that mostly this product is going to be used dealing with individuals that are under some type of mental or chemical stress, drug-induced, I don't know, a mental breakdown? I don't know exactly what it would be, but in your experience, would you think that most of the individuals you're going to be using this product on probably fall within that category?
Absolutely. People are going to be under the influence. They could be mentally ill. They could just be combative.
They could be bad guys. Yeah.
Right. It's
okay.
All across the board. It depends on the person's demeanor. Once we contact them, if we have to arrest them or take them into protective custody and handcuffs will do it, then so be it. That's all the restraints that we'll use. But if the person starts being violent or destructive, that's when we would employ the wrap.
I would guess that from my perspective, if we're going to make this purchase, whether it's 11 or more or 8 or more, I would ask maybe Robin or my seatmates, what do you think about, rather than putting another burden on our general fund that is always stretched, that we use treatment sales tax revenue to make this purchase, because that's who we're going to be assisting. We're going to be saving lives from individuals that are probably under both mental and chemical problems. So I don't know what it takes. Do 90% of them have to be under this kind of duress, or 80% or 100%? I don't know the rules for the treatment sales tax dollars, but I'd like to take the burden off of current expense if possible.
Appreciate that.
Robin?
We could check with Elizabeth to see if it would be an eligible cost.
Okay.
To be eligible for treatment sales tax, if it's not part of the treatment court, then it needs to be part of treatment. So we can check with Elizabeth to see if this would qualify.
Okay, thank you.
All right, good. Thank you, Captain.
With just one question.
Yeah.
On the, speaking of those sales taxes, how would I know is to be able to purchase? I understand that this is going in front of the board for the final approval on this, or up to you if you approve or not, on the 6th. Would I know at that point how the budget looks like where I purchased the item from?
You should know before that.
Okay.
Yeah, you'll know
All right.
before that.
Okay, thank you.
Yeah, you're very welcome. 3B is the Public Health and Social Services establishing positions.
I'm just making a note. Sorry.
That's fine. I knew you would be.
Thank you, Commissioners. This particular item, this is related to the Public Health and Social Services Department has received grants from the Department of Health and the consolidated contract to provide assistance on the septic system operations related to the how that affects the shellfish growing watersheds in the county. In order to meet the demands of this particular grant in the program, for your considerations to create two, and with an end date positions. The end date will be December 31st, 2022, and that's when the grants lapsed. And there's two positions. One is the Public Health Program Assistant 2, and the cost of that is the higher end of that position is $5,127 a month. And the Environmental Health Specialist 1, and the higher end of that is $5,935 a month. And again, this is going to be funded by grants from the Department of Health, the State Department of Health, and the consolidated contracts. And I believe Shelley is here available to answer any questions you may have.
All right, thank you. Now, do my commissioners have, my seatmates have any questions of Shelley regarding this agenda item?
No, sir.
No.
Nope, nor do I. Thank you. That takes us to 3C, DHSS, again, appointment of the Veterans Advisory Board.
Yeah, Amy is going to walk you through the applications that we have received for items C and D, 3C and D, and that's part of next on the agenda. This is just in the event that after you review those applications, you may be considering appointing those two individuals. So item C and D as placeholders after you have the opportunity to review the applications. I believe the applications are included in your packet. And again, Amy will walk you through here in a minute.
Okay. So no questions on that just yet then?
Not yet. But again, you will have the opportunity to answer any questions here in a minute.
3E, ECHO is the auditors, the voucher list, and we'll get to that.
And we'll add the dollar amount before the agenda is finalized. Yeah.
Okay. Department items, agenda item number 4, Public Works right-of-way vacation in the plat of Burbank Acre Tracts.
Yeah, this is the last step in the process related to this particular vacation request. Back in January 14, 2020, you held a public hearing related to this proposed vacations related to the plat called Burbank Acre Tracts. You did not receive any public testimony related to this particular action. As a result, the Board of County Commissioners adopted the hearing examiner's recommendation for approval by resolution number 15874, with subject to the payment and compensation consistent with Thurston County Code 13.3633030. And all those conditions of that resolution has been met, including the actual payment to this particular vacation. And this is, again, the last step in the process to vacate this property. Craig Sisson is here to answer any questions related to this item.
Any questions of Craig?
Yes, sir.
Go ahead.
When was this Burbank Acre Tracks, when was that put in?
1912.
Okay, so we've had adequate time to discuss
Yeah.
this. Okay.
Commissioner Mensah, any questions? Oh, okay. Nor do I. Thank you, Craig.
Thank you, commissioners.
Then, Jen,
that was quick, Craig. Luck out.
Yeah. Number 5 is the county manager section where we update our schedules and boards and meetings and such. And then we adjourn the meeting. But next Tuesday, October 6th, we have a public hearing at 3 p.m. And it's Public Works regarding the closure of a portion of 188th Ave Southwest.
Yeah, commissioners, this is a public hearing for you to receive public testimony before you considering closing portions of 188 Avenue Southwest. That is in the locations on the Chehalis Drive boundaries. To a larger context, this is related to more of a transportation projects. The Washington State Department of Transportation has some plans to build roundabouts along Highway 12 and Anderson Road and Moon Road. You received a letter back a couple of years ago from the chair of the Chehalis Tribe where you may consider closing 188 for local access only. As a result, the runabout of Moon Road and Highway 12 may not be needed. This has been a little bit of a long process, and the statute requires before the board can take an action on closing any particular roads within the county's right-of-way, you need to hold a public hearing just to make sure that you hear from the citizens affected by this particular action. You've heard from the staff in a couple of occasions. There has not been any particular negative feedback related to this action, but Matt Anselman is here to walk you through this item and answer any questions that you may have.
Commissioner Mensah, any questions of Matt?
No, we've gone over this several times. Good.
Commissioner Edwards?
Only has there been any feedback yet?
So we actually got our first comment regarding this this morning, actually, and it was from a local farmer who is worried that with the closure of 188, they're going to have to go around using US 12 to access their fields twice a year. And my response to that is, sure, it's an inconvenience twice a year, but the roundabouts are. The roundabout at US 12 and Anderson is going to, unfortunately, there's been numerous fatalities out there at US 12 and Anderson Road and Moon Road, and this will greatly improve the safety for drivers.
I guess in follow-up to that, is there any possibility that that individual, if he's got properties on both sides of whatever is going to be closed off and only utilizes it a couple times a year, I mean, could we give that individual ability to go through there, I guess, because I suppose farm equipment on the state highway and going through the new roundabout and everything that's going to be put in place on Highway 12, that as well could be a problem. Sure. For safety and such. So I don't know. I mean, I haven't heard anything myself. That's the first I've heard of any concern, but it might be a solution.
Yeah, and that's definitely something to consider because we'll have what's called a knock box on the gate. where the fire department and emergency services will all have a key to access that gate and open it. I'm not going to I'm not going to jump out and say yes we can in case legal's going to tell me no we can't. But that's something I can follow up on.
Sure. Thank you very much.
It seems to me if we have a Knox box for police and fire, I don't know how we would give access to a citizen to unlock the gate or open the gate, make sure it's closed without exposing the county's liability. And if he has to cross the highway anyway, to do this, it sounds like this might improve his safety crossing the road anyway. I'm not sure. But this has been widely advertised for the last couple of years, it seems.
Yes.
Or at least the last year. And you've received one comment from someone who's minimally, and I'm not minimalizing his concern, but it's a minimal concern, really, twice a year. Commissioner Menser, any questions or comments of Matt regarding this closure? No?
No, sir.
Okay. Again, that's next week, public hearing at 3 o'clock. I don't know if it'll be decided then or not. We'll have to see what the board had to say. But I'm giving notice now that I have a conflict with the governor's task force that I'm sitting on. I won't be available for this public hearing. So I hope that my seatmates will both be here for this quorum.
Yeah, so in that case, then we may want to move the action when the full board is in place.
Okay, good, thank you. And that takes, thank you, Matt, very much. That concludes the October 6th agenda. And I've got about 10:17, 10:18. Let's take about a 12-minute break. Let's be back at 10:30, please, 10:30. About a 12-minute break. We're in recess.
3, 2, 1.
Welcome back to the County Commissioners agenda setting and work session for Tuesday, September 29th, 2020. And we're continuing on with our agenda. Next is proclamations and awards. And Amy, do we have any? Amy Davis, clerk of the board.
You have a microphone.
Good morning, Commissioners.
Good morning.
This is Amy Davis, clerk of the board. This morning, there's one proclamation included. Hopefully that's better. This morning, there is one proclamation included for this afternoon, which is to proclaim the week of October 12th as Flood Awareness Week, as reviewed earlier with the agenda. There are also 2 applications included for your review. These are from Jason Matheny and Brandon Frawley, both for the Veterans Advisory Board with 3-year terms. Both applicants were interviewed by other Veterans Advisory Board members and staff, and all panelists agreed that each applicant would be wonderful additions to the board. And these are here for your review and will be included next week as well in case you have any questions. And that is all I have.
Hang on, let me see, Amy, if there's any questions. Commissioner Menser, any questions?
No, Mr. Frawley didn't really say much in his application, but if he's been interviewed and given a thumbs up, I'm okay with that.
Yeah, you're right. He didn't add there's not a whole lot added, but what he did add was very meaningful. I like that. Commissioner Edwards, any questions on these 2 candidates?
No, sir.
Okay. Nor do I. I'm happy with both of them. And so that's C and D this afternoon.
Yeah, I have those items now for next week.
Next week.
Yeah, so we'll review those 2 items again next week, and that will give you additional time, if need to look into those applications.
Thank you. It takes us to advisory boards and commissions. Oh, we just did that. Oh, advisory boards and commissions, we did that. So now we're moving on to PIO check-in with Megan Porter.
Good morning, Commissioners. Megan Porter, Public Information Supervisor. Just providing an update on the electronic signature policy that I've talked about. The policy and a draft authorization form are currently with Robin Campbell and the policy review team. Legal has already provided feedback on it, so I'm hopeful that we can get that in front of you soon. We're continuing to provide support to TRPC to help get the word out about the draft Thurston Climate Mitigation Plan. Residents can review the draft on the TRPC website and provide comments to climate@trpc.org. So both the option to provide comments and the draft plan are available at that website. I sat in on on interjurisdictional meetings and meetings with Comcast representatives last week to continue work on the Comcast franchise negotiations. We're still hoping to get this contract in front of you soon. There are just a few small things that we need to finalize, and then we should be able to get that to you. And then don't forget, if you haven't already completed the 2020 census, tomorrow is the last day to do so. Tomorrow's September 30th. And that's the last day that the census will be open. Visit www.2020census.gov to complete that census. Pending any questions, that's all I got for you.
Go ahead, Gary.
Yes. Yes, I do have a question. You say tomorrow is the last day for the census. What about those folks that miss it? What happens next? I mean, they have somebody that comes around door to door and talks to them, or
they've already been doing that.
They've already. So we're going to be done with the census.
Yes.
And then when will we get a final report? At the end of the year, or
I don't have an answer to that, but I'll bring that for you next week. Do you have Romero?
No, I think what you may be referring to, there was a federal court ruling that perhaps extended the on-visit census.
Yes.
In-person census until the end of October.
Oh.
That was just this week.
Okay, good enough. So we might have people out there that.
But that's going to be appealed. That's different. But that was the federal court ruling they extended it until the end of.
Okay, so they're going
Okay.
to have more time just in case?
Yes.
Just in case. And folks know out there that by filling this out, and what do you call it? If you're counted, you help your community, and benefits or pass on benefits and all kinds
That's
of
exactly
things,
what
right?
they call it.
Yeah, the benefits are really is to have a good count on our residents here in Thurston County, because down the road, that is going to be how we get federal allocation coming to Thurston County is based on population. So it is important to be counted.
Okay, thank you very much.
It helps in the distribution of more than $675 billion in federal funds. So the more we're counted, the more of the federal funding that we'll get.
Thank you.
And it's still only 10 questions, 10 minutes to bring dollars to Thurston County. Commissioner Brenzer, any questions or comments? Okay, thank you. Thank you, Megan.
Thank you.
Romero, legislative updates.
Yes, thank you, commissioners. I met with Deborah Manguia this week, and I'm working with Megan to finalize a draft of the county's legislative agenda for next year. So I will bring that draft for your consideration next week, and ask you to provide some feedback, additional revisions, deletions, or anything like that. Also, with Deborah Manguia, I start strategizing as to how we're going to be reaching out to the members of the local legislative delegation. In the past, we used to have somewhat of a legislative kickoff breakfast. It used to be held in December. Obviously, that is not an option this year based on the conditions that we're living in. We explored the option to have a Zoom meeting. That could be probably an option. She also suggested that perhaps one-on-one Zoom meetings may be also part of the conversation. So also we're going to be presenting you with some options as we move along and finalizing the agenda. So that's what I have for you. Questions?
All right. Any questions or comments regarding the legislative update?
No, sir.
At least doing a Zoom makes it easier to find a parking spot. You don't have to worry about a parking stall and walking a block in the rain or a couple of blocks.
Yeah, again, that's one of the benefits.
Yes.
Ramiro, one question is that we have an open seat for Legislative District 22. And I mean, Beth Dolio obviously sits there, but won't be there next year, running for Congress. Are we going to engage with both of the candidates for that seat so that
Thank you, Commissioner. Most likely the engagement with the local legislative delegation will be after the election. So it will be late November, early December. So at that point we'll know. And so that's what we're timing that reach out strategy after the election. Yeah.
Very good. Public hearing pending, decisions pending.
And none at this point, Commissioners. Thank you.
Now we're getting into commissioner items. And the first one is the 2020 point in time count and a presentation with Keely. Keely.
Good morning again. I am here with Ariel Benson from the Office of Housing and Homeless Prevention. And we are so pleased to finally bring you our 2020 PIT report. Back in March, we were able to offer a 2-page summary, and we had our first draft of the report finished at that time, but as we all know, plans were thwarted come middle of March, and we were just finally able to get confirmation from the Department of Commerce on our figure. So we apologize for the delay, and we are very glad to present what we have for you today. I'm going to just kick us off, and then I'm going to hand it over to Ariel Benson to walk us through the report. Ariel finalized the report, crunched all the numbers, put all the graphs together. So I'll let her take over in just a moment, just a quick overview. So up until this last year, 2020, we had
Will you be sharing your screen on the PowerPoint or?
Yes, we will.
Okay.
Ariel has that.
Thank you.
Yep. So up until 2020, we've been hiring outside of the county for a consultant to run the point in time count. Primarily, that entity has been the city of Olympia. And so this past year, we hired a consultant, Faith Adicott, to help run the point in time count. After hiring Faith, we were able to come up with some changes to our methodology in 2020. And I know we covered those early in the year, but just reviewing those really quickly, we had the addition, we added Cielo and Nisqually as points of contact for the point in time count, engaged them in how they would participate in the 2020 point in time count. We had upwards of 30 people who had lived experience or who were current residents in encampments to go into the encampments and fill out surveys with those living there. And we had a significant increase in those surveys being completed by unhoused and unsheltered individuals living in encampments. We expanded a 7-day count to some populations that are difficult to reach. So Roof being one down in Rochester, and then Together and several other agencies completed a 7-day count, which is approved by HUD as a methodology. The incentives that we used to give to individuals to complete a survey were informed by those individuals. And so Faith had gone out into the community and asked what it was that would be helpful or meaningful to people, and kind of a one-to-one exchange for filling out the surveys. The supplemental data we had this year. So what happens is we get the most demographic information from unhoused individuals that complete surveys. And then we pull from the Homeless Management Information System data for people staying in shelters and data for people staying in transitional housing. We don't get those in that moment demographic data. And so this year we did get the cooperation of some of our transitional housing programs to provide some supplemental data. And then we redesigned the training and really emphasized trauma-informed care for how we approach individuals experiencing houselessness and homelessness for the point in time count. It was an extremely rainy day, one of the rainiest PIT days on record, and we still had 230 volunteers show up to ensure that our PIT was successful. And with that, I will turn it over to Ariel.
Thank you. I will go ahead and can I share my screen to get the
There we go.
Okay. All right. Can everybody see that?
Yep.
Perfect. So my intention is just to run through some kind of high-level numbers from the report, go over some of the findings, as well as talk about, Keely kind of went into the methodology, but I'll kind of touch on that a little bit as well. And then at the end, you can answer any questions that come up. But if you have a question, feel free to interrupt me as we go along. So like Keely said, it was the 2020 PIT was conducted on January 23rd, and it was a very successful regional effort. We really relied on the jurisdictions individually to kind of spearhead their own efforts. Lacey, Tumwater, Yelm, everyone showed up and did a fantastic job. There was a delay in the release of the report, so like Keely said, we're very excited that we're finally here and able to share it. I know we've had a lot of interest in the community to get these numbers out. So who's counted in the point in time report? Keely also kind of touched on this. So we have folks that are unsheltered, and those are everyone that we could find to survey that were living in encampments, on streets. This included vehicles and RVs. The 2020 PIT had a concerted effort to really reach out to the vehicle and RV population. And then folks staying in abandoned buildings. Emergency shelter, those are folks that are in up to 90 days. And then we have transitional housing, which are those folks in the housing for just about 2 years is how long those programs last. So then kind of diving into the results of the data, when we look at causes of homelessness, this swapped from the last year. So eviction and loss of housing and job loss unemployment have been consistently the top 2 reasons that folks report as a reason contributing to their homelessness. The last couple of years, it's been job loss and unemployment is number 1, and that switched this year to eviction and loss of housing. And this is not, when you look at this graph, this is not individual one. This is not a total. Folks were able to link or to select multiple options. So someone could, because the causes of homelessness are not single, right? You can be rejected by family and have a substance dependency issue. So those were all the sort of listed causes that contributed to it. Where were folks staying? And this captures the entire population, all 995 individuals that we counted. I guess I should go back a couple of slides and talk about that. So we had 541 unsheltered individuals, 295 shelters. So those are folks staying in emergency shelter, and 159 that were counted in transitional housing for a total of 995. So for where folks slept for the PIT count, so where they were counted or surveyed, 30% were in emergency shelter, 16% in transitional housing, and 27% were out of doors, so almost 30. And then between abandoned building, RVs, and vehicles, really almost half were sleeping unsheltered. And then when we look at income and where individuals that are homeless are reporting receiving income from, in our community, we can really look at social programs, social service programs, EBT, SSI, so Social Security income and Social Security disability income, TANF, which is the temporary assistance for needy families, and Medicare and Medicaid are really helping a large percentage of our homeless population continue to get by. Yeah, and even beyond that, just there's a large proportion of folks that just rely on programs that are available, food banks, clothing closets. Just we have a lot of usage in our social service system. When we come to the demographics, so who's experiencing homelessness in our communities, when we look at race, we see a disproportionality. So the graph on the left is an actual count of individuals by race. And then on the right, we have the percentage difference between what was counted in the PIT and the general population. And those general population numbers are from the US Census Bureau estimate for 2019. So obviously that could be, give or take a little bit. But when you look at the percentages, it has stayed consistent with what we see in the BIPOC population of being overrepresented in the homeless population. For Black and African Americans, it was, almost 3 times the percentage. And then for American Indian, Native American, likewise, it was almost 4 times as likely to be to show up as homeless versus the general population. And then for age, for those surveyed, the likelihood of folks being homeless is larger if they are youth. We have a lot of homeless youth currently in our communities. In infancy is the most likely time in one's life in the United States to experience homelessness. And we see that reflected in Thurston County's numbers, 202 individuals between 0 and 17. And there's supplemental data that's included at the end of the report from OSPI, and those numbers are significantly higher. So we're trying to look at ways for this upcoming year to better find conjunction and ways to better coordinate our efforts with the school districts to have our PIT numbers match a little more effectively what OSPI is coming out with. For a lot of school-age youth, and then anyone above 45. We have a lot of elders in our community as well.
Ariel, is the OSPI information in any of these reports or no?
Yeah, it is in the PIT report in the supplemental data. I believe it's towards the end.
Okay, thank you. I'll have it. I'll find it.
Page 37 and 38. You're welcome. And I did, just as a side note, I reached out to OSPI recently, and they are going to be publishing their most recent numbers. So these are 2019 numbers. They're going to be publishing their most recent numbers at the end of this year, likely December or January. So we'll be able to include those in the next PIT. And then where were folks found? So where did they state as their current city when they were surveyed, or where were they surveyed? So some extrapolation was used here. If someone was surveyed in the mitigation site in downtown Olympia, they were considered to be an Olympia resident. So we have, when we look at this, we see that the majority of folks that were surveyed are staying in Olympia. Olympia has the highest density of shelters, meal services, food banks, service providers, showers. It's also the highest density of encampments that are known. The methodology that we use is a known location. Thurston County is quite large and quite rural, and doing a complete census, so going throughout the entire community, really digging into all those rural areas to see who we could find is not very feasible. So we really focused on working with providers in the known locations in the county that we knew we were going to be able to find folks. And then where did people state they were from? So this is some new data that we were able to capture this year. Not only their last known permanent address, but then also how long they had lived in Thurston County before they had become homeless, if they were a Thurston County resident. So looking at these numbers, we see that about 3/4 of folks have lived in Thurston County or the surrounding areas directly prior to becoming homeless. And then how long they lived in Thurston County, the majority of folks that answered this question have lived in Thurston County more than a year. So they've been here for a while. All right, well, that kind of runs through the kind of high level data. What we're looking forward to for this next year is we've already started working at reaching out to jurisdictions and partnering with them. What we're waiting for is guidance from Commerce and HUD about what they are hoping the unsheltered count to look like this year. HUD requires a count every 2 years. Our Washington State COC requires it every year. So we're waiting to see kind of what that guidance comes out given the COVID-19 and what that unsheltered count will look like. We will be moving forward with the sheltered count, so those that are in emergency shelter and transitional housing, along with our housing inventory count that's required every year as well. So it'll just be a question of what that unsheltered count will look like for this next year. And then we are excited that we are on the brink of releasing this along with the 2-page report, and we'll get it out to the community. And if you have any questions, I'd be happy to take them, whether it was about this data or anything that you've seen in the report so far as well.
All right, Commissioner Messer, any questions of either Ariel or Keely?
I don't think I have any questions at this point. I'll defer to you guys.
All right, Commissioner Edwards?
Just on one issue, on page 19, we talk about sources of income. Do we know the amounts that are associated with those sources of income? I mean, I don't know if, I'm sure different individuals have different incomes of one type or another, but do we ever try to quantify that to see what people are getting by on?
So I can kind of speak to that. Yes and no. So as part of the point in time count, that has not been a point of data that we have normally included, but in our quarterly and annual housing report, that is information that we can get into. So we can look at their average annual cash income or how much they're bringing in. And that is something that we're looking to include in our 2019 to 2020 fiscal year annual housing report.
Is there a process in place, for an example, if we're going to direct someone to a particular assistance group, do they require this at all? I mean, that we need to know that they need it and how bad they need it, maybe. Is there a process that falls somewhere else that we just didn't capture? I guess that's what I'm looking for.
I think I'm not quite following your question. I'm sorry, Commissioner Edwards. Would you mind repeating it?
Well, what I'm wondering about, we're keeping track of a lot of things, And I'm just wondering if there is a mechanism in place so we'd have a better sense of, you know, how these folks are getting by, and then maybe we could even analyze what they have to do to get by and see where they fit on the spectrum of prioritizing, for an example. I'm just kind of curious. I know if a person is on SSI, I don't know what that means as far as a dollar amount. Maybe it has to do with their age or something else. I know a lot of things that I don't know, but I know they can't get by very well on not much. I'm just kind of trying to make it all fit. That's all.
Some of that is captured in some of the narrative of the 5-year plan. And so it's not impossible to get that information. There are several different sources where we can look at the minimum hourly wage an individual needs to make in order to afford a 1-bedroom house or apartment compared to what a person might take home with Social Security income. So that's not necessarily difficult. It's just bringing together different kinds of data and putting them all together. So not impossible.
Oh, okay. Well, I'm not advocating that you do it or not. I just wondered if it was there. The other thing is, of these close to 200 individuals, are there any moves afoot to create, I don't know, almost in Europe and Japan and places like that, they almost have slide-in sleep areas, I guess. Do we do anything like that around in Washington State that you're aware of, like a hospice, or I don't know if that's the right term.
Like a single room occupancy kind of.
Yeah, even smaller than that sometimes. I mean, you know, the bathroom down the hall and such. Do we try to come up with something to keep these folks in undercover, if you will, warm and dry?
Certainly, we do all that we can within our means and within what is developed and then what is zoned appropriate to each jurisdiction and any location where we might be housing individuals who are unhoused. We've been relying over the last, however long on shelters to be the primary source for individuals to come inside. And that, of course, is severely challenged with COVID-19 and physical distancing, as I've mentioned before. That being one of our only options has cut our available beds nearly in half, even with the cold weather season coming up. So no, we don't have any options such as that currently. That doesn't mean that they won't come online or something similar in the future.
Okay, well, thank you very much.
Okay, Kelly, maybe this might be an innovative idea that we can probably bring in front of the Regional Housing Council.
Yes.
Yeah, I think we can explore all the innovative ideas that we can have to address this issue. So I thank you.
Mm-hmm.
I have two questions. One is regarding the 2-page sheet that you supplied. The front page shows in the center the LGBTQ with an asterisk. When I look down the asterisk, it says 674 persons surveyed. Is that what that asterisk is from or for?
That's correct. Yeah, to imply that data was not captured for all 995 individuals.
Okay.
Yeah, and that's a piece of data that was only included as a sort of aside for the Thurston County PIT. That is not data that's standardly is collected in HMIS. So we did not have that for any of those staying in emergency shelter or transitional housing.
Oh, interesting. Okay. And on page 38 of the multi-page report regarding the kids and the OSPI, the chart shows over 1,700 homeless kids in Thurston County.
That's correct.
And right under that scale or that chart, it says the Tenino School District, the number of students doubled up was suppressed as sensitive data. Can you explain that for me? Because I saw in one of the other things that Tenino wasn't included in one of the counts.
Yeah, so any location information for youth, generally any count that for OSPI releases that involves kiddos that are like 10 or less children in a given school district or a given school that are going to be reported, they suppress it as sensitive to protect, because it's such a small demographic and it's a vulnerable population. And so when we coordinated with Commerce, they likewise indicated that they would like us to suppress any location data for 10 or fewer youth, which is why you see that in the location breakouts as well, that information is suppressed.
Got it. Okay. So did that show up then when it said, hang on. It's very intriguing. Where was it? Data were surveyed, not collected. Is that how it would be? They'd be counted, but you wouldn't know where they were counted from. On page, it says current city where it's surveyed, towards the back of your document. Because Tenino's not in there. You know, you list Rochester, Tumwater.
No, yeah, the numbers from Tenino were small enough to break out the demographics as a chart didn't.
And this is not just.
I don't think it didn't make sense. It was just there wasn't very many that were counted in Tenino.
Okay, and this is not just kids though in this chart.
That's correct. Yeah, those are everybody that was surveyed.
What I find intriguing and very saddening to read, but I know it's the truth, is nonetheless, it says the evidence can be derived that homelessness, this is regarding kids, in Thurston County is a larger issue for families and children than the PIT enumerates.
That's what I was kind of, speaking to with that 202 count for the PIT of those that are 0 to 17. And then we look at OSPI's number of 1,700. And we are very clear that the numbers that we're able to capture are not complete. And that goes beyond just what's considered technically homeless. So those that are doubling up, staying with friends and family, are not considered homeless according to HUD's definition and are therefore not formally included in the PIT count, but they are considered homeless for the McKinney-Vento Act in regards to OSPI. So
right, and I've been hearing it for years now that like today it's sunny and it's going to be a beautiful day, but still it's not a beautiful day for the homeless. And in the fall and in the winter, school bus drivers dropping children off at the base of like Capitol Forest and different places where the kids wander off and sit in a car or a van or a camper, and that's how they live their life, and just horribly sad. So thank you both for doing what you do. Any other questions, commissioners?
No, sir.
All right.
I have one quick question.
Yeah.
That I thought of. So on the causes of homelessness, is there a choice that I'm on the survey that are folks given the choice to select no cause? I choose to. Services are good in Olympia, and I like to live in a tent. It's easier than having a job. So there's no cause to my homelessness other than my personal choice. I've heard theories of people that's some people's choice. And I'm just wondering if that's a choice that's given that we would have any data on, or if that's not even, they have to choose some external source of.
There is not on. On the PIT survey, there is not a choice for that. It is circle all that apply. So if it didn't apply, they theoretically wouldn't circle one, but that's an absence of data, not collecting it. So no, there's not an option for that.
In my experience, though, I was just saying that there was a brigade of helicopters, so I couldn't speak. In my experience in administering the PIT survey, either people refused to participate or they never did they refuse to answer that question. So there was always a reason or something that they circled. Another really important fact around our PIT this time is we did a kind of a rudimentary and totally not scientific scratch mark. So anytime anyone refused, we marked it literally in chicken scratches just to get kind of a sense of how many people were refusing to participate. And it was to the tune of over 350 people refused to fill out the survey. Of course, we cannot unduplicate that. There could be some duplication, but it was just kind of an exercise into see how often are people refusing to participate versus people filling out the surveys.
One of the things that caught my attention here that's probably worth noting for the public is just that we've had a lot of discussion over the last 2 years about the number of folks coming from out of state. And the Seattle Times tried to take the data up there and crunch it. And you know, they admittedly said it was imperfect, but the best they could come up with was it was about 15%. And now your data here is showing 14%. So that seems to that's starting to show a pattern of maybe a number that we can sort of use. 90% has been used by folks, and that just seemed to be completely without support. And I'm not seeing support here for any number anywhere near that level. So I just wanted to call attention to that because I was looking for that because that's something that we've been talking about here over the last couple of years. 14% is a lot different than 90, so that's important for folks to know.
It's also, this year we broke out city by city, so demographics per city, which is a little bit different than the ways that the report has been presented in the past. And so you'll notice that per city, if individuals are identifying if they're from that city, how long they've lived in Thurston County, and et cetera. So that I think is really good information. I know that I was 68% or so. I don't have it right in front of me, of the people surveyed from Yelms claimed that they were from Yelm. And I know that attending some of those housing task force meetings last year in Yelm, that was not the understanding of individuals that attended those meetings. So just really good information about who these folks are and where they are coming from.
Well, this graphic here on the right shows that overwhelmingly those folks have been here for more than a year, in an overwhelming percentage. So it's not just the idea that I showed up 2 or 3 months ago, I say I lived in Thurston County, so therefore it's getting counted as a Thurston County resident, when most of us wouldn't necessarily think of that as being, and I've understood that criticism. I mean, if someone's been here for a month, you know, they may say they live here, but I don't necessarily, as a longtime resident, think of them as being a resident here. So this is kind of helping to clarify that a little bit, which is good.
Well, this is important data to collect, but it's even more important to collect it if we're going to do something with it, and either continue or redirect services and efforts in the areas that are identified. Thank you both very much for this.
Thank you.
All right.
Thank you,
Now
Commissioners. So with that in mind, so we will go ahead and publish this report for public viewing.
Yes, please.
Thank you.
They'll be on the county website and PHSS and such.
All of the above.
Everywhere, okay. Coronavirus Relief Fund, follow-up and direction.
Yeah, thank you, Commissioners. This is a follow-up to the item that we staff brought to your attention last week. Where we left it last week was 2 areas. As you may recall, you set aside $1 million to get some feedback from Dr. Abdul-Malik. Based on her perspective, really, all the public health needs at this point are met related to the coronavirus relief fund. There's still the question whether the additional allocation from the Department of Health to public health can be shifted in terms of to better utilize our allocation. So that is still remaining, but in the meantime, we would like to have a conversation with the board as to how you would like to allocate the additional funding. We have a couple of proposals for you, but before we get to that point, and again, the proposals that we have is the $1 million that, from the public health, Department of Health allocation. And then you heard about the surplus of the initial 15.7 million. And I think we have a number for you to consider today, as well as some potential actions. Last week, there were a couple of questions that you asked. First was related to schools. have we reached out to the schools and asking if they need any type of assistance related to this funding. As you may know, through the United Way, there is an effort to fund access to Wi-Fi to all the schools that becomes available. I believe Shelley, when her and Dr. Abdelmalek met with the superintendents last week, that question was asked about any additional funding to the schools. And I believe the answer no. At this point, they don't see any additional needs for this money. And that was one of the questions that you had. Also, you asked the questions to reach out to the BHO. I know the acronym has changed, but I continue to use the BHO at this point. We did reach out to the BHO. It is our understanding at this point, the CRF funding request seems to be a request to cover internal expenses, such as electronics and PPE. Based on that perspective, we have asked them to reach out to the Thurston Strong as to how they can probably get access and get funded to meet their demands of electronics and PPE. Those are the two questions I believe that you asked to follow up last week. Before we move forward, any additional questions related to that?
Yes.
Yes, sir.
Yeah, and I actually referred them to Thurston Strong a week ago or so as well. So that's good follow-up information.
Okay.
Go ahead, Commissioner Edwards.
I guess my question is, I had asked earlier about testing supplies for schools having to do with safety and such. And so am I hearing back that the schools don't need any help in this regard?
Well, the testing is conducted outside of the school purview, and the testing will have to be meeting the demands of the needs. So because the school are not performing the testing themselves, because they're not in the position to do so. But certainly, if when the schools may consider reopening, and there may be a need of increasing of testing, I believe we need to be able to respond to those needs currently. And maybe Shelley can follow up on that comment.
I guess just as a follow-up on that, St. Martin's, who have live-in students, they purchased themselves, I don't know, thousands of, I think, instant test kits so that they would be able to utilize those as they're dealing with their population. So I guess I'm wondering, do any of the public schools do that? I know one of the schools had an incident where a special needs child was sent to school by the parent, and the parent actually knew the child had coronavirus, or he had been tested positive, I guess. So, and I'm not condoning that. I'm just wondering if there's some way that we can kind of prevent that from happening through instant testing. And I don't know much about it other than St. Martin's College did purchase a bunch of these kits so they could address it in a more timely fashion, I guess. So maybe this would be for Shelley, I suppose, about, is that a possibility? Are we running into other situations like that where we have irresponsible parties that, I mean, they knew the child had it when they sent this child to school. So that kind of drives me up the wall that we don't have a mechanism in place to test it kind of quick. So Shelley, I guess.
Sure, sir. In terms of testing, Ramiro is correct that the schools do not plan to offer in-school testing. The procedure is to refer students and staff and teachers that may have symptoms or may have been exposed to COVID-19 to their healthcare provider or one of our community-based testing sites, which we are currently expanding to include purchasing rapid testing machines as well as additional testing that Dr. Abdelmalek discussed earlier. so that people will have easy access to testing in their area and be able to quickly obtain it. So that's our goal. We are trying to procure testing machines. Dr. Abdimalik has reviewed the various testing equipment out there, and there are various types of tests, some with varying reliability and accuracy, as you heard her also address this morning. So we have a few machines that we are focused on trying to procure that equipment, but also we have to make sure that there's sufficient supply chain for the tests themselves. So we're also working on that. So that will be offered to the schools. We've also had some meetings with our higher education partners about how we can support either their own testing or how we can help to have community testing events and availability to serve students who are on campus and cannot leave if they are symptomatic. So that's all part of our community-based testing strategy that is currently included in the funding allocation that we have requested and that you have approved thus far.
Okay, thank you.
Great, thanks.
I wanted to go back to we're calling the BHO, because, and Hutch can jump in if I've got this wrong, but at the meeting yesterday, we were talking about not only the computers for telehealth, the PPE, but there was also significant overtime expenses for crisis response to the point that they're now hiring 3 additional crisis response personnel because of the direct uptick in crisis calls related to the pandemic, and that Joe and Mark said they had been in discussion with our auditor, Brandon, about that eligibility, and they were still in discussion about that. So that was the focus for me, not so much the PPE or whatever, which, as you say, could go through Thurston Strong, but I was thinking that there might be a good nexus there with the uptick in crisis response related to the pandemic.
And I specifically asked that question, if the hiring and the uptick in the crisis response was directly related to COVID. And they said, absolutely it was.
Commissioners, it well may be that probably after they have iron out that type of conversation with the term leader, may be coming back with an official proposal. Okay. So this is the information that we receive, at least at this point, from Brandon, the internal letter as to what the current need is. It could be the additional request may be coming from the VHO, but that's the only thing that I can report at this point.
Okay. Well, we'll hear back from the BHA.
The BHA, sir.
Yeah, when we hear. Is this, what we're discussing now, though, is it different than the PUD request? As that'll be a separate?
It's all inclusive.
Okay. Do you want to cover the PUD request?
If you like, yeah.
Could I do one more comment on this, Hutch, before we move to that?
That's fine.
I continue to hear that testing is a big piece of safe schools and getting schools opened. So I've kind of been harping on this adequate testing equipment to include whatever we need to do to be more responsive to the schools. But as we kind of struggle to make sure we do a proper expenditure of this CARES funding, wouldn't it behoove us to make adequate purchases for the future with current dollars that we have on hand through the CARES program? It doesn't say we have to use the test kits up by October 1st or whatever the deadline is. I think we ought to be planning for the unknown in the future that we might be faced with. I would much rather have too many tests on hand that they came up with a cure and a vaccine and everything. I'd rather have too many on hand than be struggling come October 1st to say, well, we'd like to test you, but gee, we're out of money and we're out of test kits. And are we talking at least about planning ahead for that potential problem?
Yes, that is the strategy. You may recall when we had a larger conversation maybe a couple of weeks ago when we had the conversation related to the rapid testing machines.
Yes.
And that is the intent, is to secure as many testing as we got. But also the back end is the supply chain. It's not just Thurston County who's looking for purchase additional testing. It's just the country and perhaps the world who are in need as well. So we are making a heroic effort to do whatever we can, I believe, to secure as many testing as we have, as well as testing machines.
Okay,
so that is part of the strategy.
Okay, thank you.
Would you like to add anything else, Shelley?
No, that's correct, Romero. We're doing everything that we can to anticipate what we think will be needed in terms of testing as we go into the winter season.
Yep.
Okay. Then will you cover the PUD request, Romero, please?
Yeah, we can do that, but it's related to the overall allocation, but we can start with that. So before we can, I can walk you through the PUD request. Let me paint the picture for you as to what that is. So we have the $1 million from set aside from the Department of Health. They set aside to provide some feedback from Dr. Abdi Malik. You heard last week that perhaps there is not a need. So there's $1 million that perhaps has an asterisk on that, okay? And then the surplus of the initial $15.7 million, and that is $900,000. So $1.9 million, they'd like to frame that for you, okay? And we'll go back to address that. So related to the PUD, you received the letter dated September 24, 2020, from the Thurston County Public Utility District, where they are requesting $242,107.46 to help mitigate some of the funding related to their operations. And they state in this particular letter, in so many different words, that perhaps there's many citizens or many ratepayers that have been not been able to pay the utilities on time, and as a result, they have seen the decrease on their revenues, as that's my words. There is a couple of elements on this. There is not a question on the need. There is not a question on the need of the ratepayers. But yesterday, during the Washington Association of Counties, it was just timely because this particular issue was discussed. And the Department of Commerce, a representative was there to give us some guidance. And that pretty much clarified, at least from my point of view, as to how we were able to meet the demand of the PUD, or the request from PUD. The Department of Commerce suggested that perhaps a direct allocation to the public utility districts may not be adequate, because that may be considered to be supplementing the loss of revenue. And the CARES money is specifically related not to address the loss of revenue. And the loss of revenue, if that was the case, then the county would have taken advantage of that, but that is not part of this CARES money. So the question is, how are we going to be addressing the needs of the ratepayers? And that is a proposal that we have for you. As you may recall, we set aside close to $30,000 as a mandate from the governor's office to provide some subsidies to utility ratepayers who may not be able to pay their utility bills and prevent it from being shut off. That was set aside and was given to the United Way, and through the Community Action Council, that is in place to for any citizen or any ratepayers who has issues and challenges on paying their bills to access and get a grant from that level. It is a modest grant. At this point, it's, again, 30,000 or so. So the proposal before you today is for you to consider, because there is a need. I do believe there is a need for those ratepayers to get some help on their subsidies, on their utility bills through a subsidy. So one of the recommendations for you to consider, and that will be my proposal as to how you may consider responding to the PUD request, is for you to increase out of the surplus of the $900,000 from the initial allocation to increase utility subsidies, who is currently managed by the Community Action Council, by an additional $170,000. So then the overall funding the Community Action Council can provide to the citizens in need of utility subsidy will be $200,000. And I believe that may be addressing, for the most part, the need of the PUD. And as a result, the citizens and the ratepayers will benefit from that, and also the utility also may be made whole in a way by paying the overdue bills. That's what I'm suggesting for you to consider related to the PUD request. And before we get more into the additional suggestions, I will stop there and answer any questions that you may have.
And if the board were to do that, CAC could earmark that money for the ratepayers for the PUD?
Say that again, I'm sorry.
The CAC would be able to earmark that $107,000 for the PUD ratepayers?
It will not be specifically related to the PUD ratepayers. It will be for any ratepayers.
Any ratepayers?
Yeah.
Okay.
It's just the program, because the program may not be narrowed down to, it will be to every single ratepayers may have issues in the county. And that is the intent of the program, without narrowing down to a specific group of individuals.
All right, Kai, did you have your hand up?
I didn't have my hand up, but I have questions if you're calling on
me. Me too.
You felt it. So that was a lot of information. So I need to just kind of backtrack. So 170,000. Where's that money? What's that number reflect?
So let me get back. Okay, so the $15.7 million initial allocation the board took, there was a lot of line items that you allocated, including $6.4 million to public health, internal needs. As a result of that, you set aside, I believe, 2.5 to cover back costs, labor costs in the county, as well as you set aside for upcoming needs. So we are seeing.
I understand there's 900,000 remaining. My question is, why are you choosing 170 out of 900 or 1.9 million to go to this?
Because we have a proposal for you for the additional money, and that was.
That's okay. That's just what's left.
So that's what.
So we're getting ahead of ourselves.
No. That's just a suggestion, because we have a proposal. Because one of the suggestions the board had is how we're going to be supporting the agricultural side of the county, and that is with the remaining, I don't know, 730,000. You make, and there is a proposal before you in here related to how you consider supporting the agricultural side. So that is okay. That is why.
Okay, so I got that. Now you said it was going to be added to 30,000 to make 200. 30,000 is like what we previously allocated for utility payments, or what is that 30,000 you referred to?
Yeah, go ahead,
Robin, go ahead.
The 30,000, if you will recall, out of the 15.7 million, Public Works had come forward with a need requesting 30,000 on behalf of their ratepayers. So we funneled that money through the Community Action Council to approve to eligible ratepayers of our utilities. And this money would expand it to any utility. So instead of 30,000 for Boston Harbor, Grand Mound, Hamishan, it would be 200,000 for any public utility.
including the municipalities?
It should be for any.
Yeah, including the municipalities.
So I mean, and I don't dispute what the PUD's saying. I just want to share this, that every month at LOT, we have a discussion about this. And I sit on that board with a representative from each city. And at the beginning of the coronavirus, we were like, oh my gosh, we're gonna need to be, we were actually pre-preparing a program for the eventuality when we were basically expecting the whole economy to drop into the abyss and that nobody would be able to pay their rates. We were prepping a program. And as it's turned out, the report every single month from Olympia, Tumwater, and Lacey is that utility payments are coming in pretty much right on schedule. There's always 1-2%, and that hasn't really changed. And I'm just wondering why the PUD's customers are $250,000 in arrears when that's not the case in any of the cities. Does anybody have a theory about that, or?
Well, that is a good question, and unfortunately, I don't have the answer to verify or not their numbers. But I do believe there is a need to increase the subsidy for those individuals, for those ratepayers that perhaps are in need for a subsidy. And I believe the $200,000 can take us a long ways. And I encourage the board not to narrow down on a specific group of individuals that may, but just make it available to countywide as you have done in the past to provide those subsidies related to any, like the rental assistance. There is no municipal boundaries on that. Anybody from the county can access that. And in this particular case, the suggestion from the staff or the recommendation from the staff is you to consider as well, to increase utility subsidies to $200,000. Up to you. Yeah.
And then we can send a letter to, I assume that you're then proposing that we'd send a letter to PUD saying that because of some of the requirements of the money, we're not going to do it in the way you suggest, but we're trying to meet the intent of what your customers, and here's how you go about it. And
yes, if the board feels okay with our proposal, certainly I will follow up with that, with the correspondence to PUD, and will provide information as to how their ratepayers can access the subsidy through the Community Action Council.
Right.
Robin?
So this is part of the reason that you run it through the Community Action Council. The ratepayer must qualify through a reason related to COVID for the subsidy.
Right.
And the CAC is almost uniquely qualified. They do that type of means and review testing. They've already done it for electrical payments. It's something that they do. So they're going to be reviewing, and they'll work with the utilities to reach out to the ratepayers and say, here's how you apply and here's the criteria you have to meet.
Yeah, and thank you, Robin. And if a ratepayer qualifies for the subsidy, it will not be a monetary contribution to the ratepayer. It will be a monetary contribution to the utility.
Right.
Similar to the rental assistance, it will not be a direct payment to the individual, it will be to the landlord. So that is the proposal before you. And I believe $200,000 in utility subsidy will go a long ways for those who need it.
Is that it, Ty?
Those are my questions.
Gary, go ahead.
I guess I think Robin kind of answered my questions in regard to who's going to keep the books, and keep commerce happy, I guess. So it sounds like we've got that part of it figured out. I am kind of curious. I like the idea that the county manager laid out, but what's the difference between helping somebody with their rent, grants for rent versus grants for utilities? I guess I'm just wondering out loud, how's that going to work? But we're going to use the same concept, it sounds like, from what Robin said,
Yeah,
to get it accomplished.
yeah, it is the same concept because on the rental assistance, obviously somebody who's going through a rental process and they don't have the means to pay the rent itself, sometimes the rent includes utilities.
Okay.
In this particular utility subsidy, may be a homeowner who is not able to pay the utility rates, and this program will allow to reach out to them as well.
Thank you. Thank you. I'm good.
And I don't have any questions. I've
Just
got them all.
one last thought on this particular request is also, as Robin has stated, the reason as to why the board provided the CARES money through the United Way, through Community Action Council and Thurston Strong, is to make sure you have a hub in which they can vet all the different requests on a systematic and appropriate way. And at that point, the board is not in the position to entertain any individual request, because at the moment that you entertain individual requests, then you better be prepared to entertain just about 100.
Yeah.
So, and that is probably what my suggestion is, to walk the fine line on this, identifying the need, and perhaps addressing the need at that level.
All right. So which direction do you need now regarding the agriculture and this? Just lumped into one?
No, and again, my suggestion, since you asked me to address the PUD request, if you're okay with my proposal, then we'll move forward in responding to the PUD request on those terms.
Okay. So you're looking for a thumbs up or down? Is what you're looking for? There's a thumb up.
Just on the PUD.
For the PUD?
I'm tentatively thumbs up, but I kind of need to hear the rest of the proposal for allocation to make sure it fits.
Yeah, fair enough. So for the remainder, you asked last week, and we sort of highlighted perhaps the need to provide assistance to the agricultural community, which also have been impacted by the pandemic. So Jenica has reached out to Stephen Branwell to see how we can probably bring proposals to the board. So at this point, I will stop here. I don't want to steal Jenica's thunder. And this is the next proposal for you to consider on the remainder 730,000, if my math is correct, as to how you may consider allocating for agricultural needs in the county. Jenica.
Great, thank you. So as Ramiro had mentioned, in front of you, you have the agricultural industry support proposal. I've worked with Stephen Bramwell from WSU Extension and Aslan Mead with the EDC, who have developed this proposal. The items outlined in the proposal are identified investments to support our local ag industry, who have seen market disruptions. COVID has caused producers to lose key buyers like restaurants and farmers markets. And these investments enable the development of new markets that can diversify where producers can sell their goods and help reestablish lost revenue streams. And so the proposal has been broken up into 3 different scenarios with funding levels at roughly 200,000, 500,000, and then the last one was 945, but was rounded up to $1 million just for discussion. The proposal builds upon itself as you read through the scenarios. And so scenario 1 has a refrigerated storage and distribution infrastructure, and then that's coupled with grants supporting farms and farmers markets. And then in scenario 2, you see those same items, but then adds agricultural product processing equipment and then equipment for frozen processed product sales for institutional buyers. And then the final scenario 3 for 945,000 adds general value add product processing and infrastructure and field operations. And so within this proposal, it states the initiative, the amount, the target investment, and the target impact that would be seen with each of those investments. And so Aslan Mead with the EDC has noted that filling in these strategic gaps will directly and immediately assist businesses that are struggling due to the impacts of COVID, while also helping build systems that will move our agricultural community forward for more resiliency in the future. Do you have any questions on the scenarios at the moment?
So regarding the agricultural investment, commissioners, any questions, Gary?
Well, my only question would be a grant on the first page, on your first page here to Romero. Thurston Strong would administer a grant to Southwest Growers Co-op, I guess, for equipment. And that's what you're referring to, like the freezers and cooling apparatus, that kind of thing?
Yes, sir. And again, the intent is to if the board agrees to allocate the additional $730,000, and Thurston Strong will manage that distribution, obviously in coordination with Steering Brumble. But anything to add on that, Jenica? Because I believe that is the intent.
Right, and that is the intent, but we are making sure that we're working with our team, our internal auditor, to make sure that however we set up the administration structure matches the CRF guidance.
I guess one follow-up piece then would be, if we do this, and I don't know where we're at on the Tenino. Yeah, right. Where we're at on that. If we are moving forward with this, and when this thing's all over, is there any chance that that could benefit that ag park as it winds down? I mean, would some of the equipment fit to help agricultural folks bring things to market and such? Whole storage areas or something. I don't know. I'm just wondering. I was thinking out loud that we might get a double benefit when this thing's over. But
yeah, so that's something we could look into. But I think part of this is that it does address immediate COVID impacts, but also helps improve our local food supply chain for the future resiliency.
We're getting that double benefit, but any money we spend has to be shown as necessary in response to the pandemic.
Sure.
Yeah.
But you're right. It will have long-term benefits. Absolutely.
Okay. Yeah. Just want to think about it from that way, that perspective.
Especially buying equipment. Yeah.
Okay.
Thanks, Ty.
Yeah, so I mean, I had the same questions as Commissioner Edwards, and I want to just kind of go further with this. So the concepts I understand, but in terms of the specifics, so if we buy commercial kitchen processing equipment components and quick freeze processing equipment, where's all this equipment go? What are we're spending money to acquire it, and then who gets it, who places it where for the people who need it to use it, the farmers?
Mm-hmm. So one of the options that we're looking at is the Southwest Growers Co-op, who is open to farmers, ranchers, and food processors. And so it would be available for multiple different users, but we're still looking to make sure that however it is distributed is done in accordance with our CRF guidance.
Where's the Southwest Growers Co-op located?
In Thurston County.
And where in Thurston County?
I would have to get back to you on that.
Okay.
But it does have a regional reach, and part of the conversation was ensuring that this is beneficial to Thurston County businesses, and it would be located within Thurston County.
And then kind of this is dovetailing on Commissioner Edwards' point. And then when the pandemic is over, the county retains the ownership of this equipment, or where? Jenica shook her head, and Robin nodded, and Jenica shook her head no.
Well, I think it would depend on how we structured the purchasing of the equipment, which could have it could look a few different ways, which would change who owned the equipment. But
So if this is a grant, we would grant the money to the Southwest Association and they would own the equipment that they purchased with the grant. We would determine that the association was impacted by COVID, grant the money to them, and then what they do with it is their business. That's how this money works. Otherwise, they're a subrecipient, and the ultimate owner of anything purchased is the end recipient. And that would not necessarily be the way we'd want to set something like this up. But that's why we're, I'm sure, working with Brandon to ensure that we meet the criteria of the federal rules.
And would Stephen have a place to put this stuff? I guess that's what where he fits
at the
in
end
plan,
of the day,
right?
the county doesn't want to own farm equipment.
Right.
Yeah, we don't want that.
No.
Yeah,
Go
we
ahead.
don't want to own farm equipment.
Go ahead, Todd.
Southwest Growers is not a group I know very well. Is that a wide open group that every farmer in Thurston County is part of, or is it an exclusive group, or is it only dealing with certain types of agriculture? I mean, how exclusive or wide ranging is it?
So it's any producer in Thurston County can join the co-op, like farmers, ranchers, and processors. And so that could be anything from baked goods to dairy products. They said salsa, sauerkraut. It sounded pretty diversified, and it's open to any producer in Thurston County.
And how many are part of it? Do we know that?
Currently, there are 18 members. It was just recently incorporated in early 2000. And so this is a new co-op.
Early 2000?
Oh, 2020. I'm sorry.
Well, that's 20 years. All right. Well, if this is something we're trying to get going as a regional thing, then this could be a shot in the arm for it, maybe.
I have a degree in Google, and I can't find it. But it could be because I spelled it wrong. So I would like some follow-up on that organization, but I'm okay with it as well.
I think if we tagged the money as specifically to support agriculture, we can work out the details.
Yeah, that is, thank you. That is the intent. Without getting too much into the details, that's what we have Thurston Strong to administer those grants, just to make sure that we create the check and balances, just to ensure your perhaps concerns or questions are met. And again, at the end of the day, we have an obligation to make sure whatever money is distributed meets the criteria of the CRF funding.
Right. We don't want to get duped in any way.
And is Stephen Bromwell's going to be kind of involved in this? I'm hoping.
He is.
He's mixed up in it, right? Just one follow-up question, and this might be to Robin, maybe not directly associated to this, but the allocated dollars that we've given out, some of those dollars have timelines for expenditure and stuff on it. And if it's not spent, do we get that back to reallocate it? Are we the ones that will try to reallocate that rather than waiting until it goes back to Commerce?
So we are carefully monitoring what everybody is spending, which is part of why we know we've got 900,000 internal that needs to be reallocated. We're working with our external partners to reassess how much they're going to spend. So far, they say they're going to spend it all, but we'll look again in about 2 weeks to see how they're doing, because we do want the opportunity for the board to reallocate it rather than to send it back to the state at the end of November.
And in fact, yesterday we had a discussion with the staff. We're going to be drafting a report to bring at a higher level as to for you to have a perspective on the expenditure rates of all the many different allocations that you have already done. And Jenica is working on that report, whether it's every 2 weeks, every week. But certainly we're going to keep you posted just to make sure that in fact you have the option to reallocate if you see the need to do so.
Right.
Thank you.
So
All right.
go on, sir.
Go ahead, Ty.
Just quick, Ramiro. So if the board adopted scenario 3 and adopted the 172 for the utilities, that's leaves 730,000.
Yeah, those are the scenarios they proposed, but I believe, as you can see, the scenarios can go from $200 to $1 million. And I believe the $730,000 will meet as much of their needs as stated on those reports, on those proposals. So
I thought you said there was 1.9 million though. I thought you said was what we're trying to
So the
deal
other
with.
million, we have another proposal.
Oh, okay.
Yeah. And the reason that I'm separating, because the other million has an asterisk. Has an asterisk related to the Department of Health. That we need to make sure that, because if, I don't want to come across perhaps that you make, decisions to allocate to the farms. If the Department of Health allocation doesn't materialize the way we would like to, then you'll be forced to take those back. That makes sense?
Yep.
So that's what I'm trying to separate in two different buckets.
I just didn't realize there was another $1 million proposal coming. So
yeah.
So is that coming later?
Right now.
Right now. So we're going to be giving a thumbs up or down to the ag support.
Yeah.
Thumbs up or down to the PUD, and a thumbs up or down to the million.
Yes, here. So I will ask if you're okay with the proposal, and again, of the $900,000 that is the result of the surplus of the initial $15.7 million, the $170,000 will go to support an additional utility subsidy, and $730,000 will be to create a new program to provide agricultural support to those in need, and that will be through the Thurston Strong, and the utility subsidy will be through the Community Action Council.
And Thurston Strong is, I'm sure Jenica would tell us if they could get this thing rolling at that in these timelines.
Yeah.
Okay. The ag effort.
And Gary, I didn't see your thumb from the distance here. Is that up or down?
Yeah, if Jenica says okay, I say okay.
Okay, thank you, Commissioner. Now the conversation on the asterisks. And as you may recall, the asterisk is $1 million. There is a couple of asterisks on the allocation that you did. It was an additional $1.5 million asterisk to Thurston Strong, and an additional 1 million asterisk that was given to United Way. So this is the additional asterisk that complements the allocation to public health. So, and the asterisk means that the county holds the option that if we don't resolve the supplanting requirement the Department of Health has done, the board will consider taking those back, so we don't find ourselves in the position to have be in the red per se. But at least at this point, there is an additional $1 million an asterisk that you may consider allocating. And the proposal before you is to consider allocating the $1 million to support the child care needs in the county. And the child care needs will be to increase the grant amount the Thurston Strong is currently allocating, and that way we can probably continue to serve the needs of childcare. Jenica, you want to elaborate on that?
Sure. So this one will be a lot simpler than the one I just ran through, but so Thurston Strong, with the previous allocation that you approved, had created an additional childcare grant that ranged from $3,000 up to $18,000 per provider. That was dependent upon the amount of available slots that they were able to provide. This additional $1 million would double the ceiling. And so any provider that had under 16 slots would then be provided $6,000 in grant funds. And then the highest maximum for providers who have 101 slots or more would receive $36,000. And so the range changes from 3,000 to 18,000 to 6,000 to 36,000.
So and again, I'd like to emphasize the asterisk, what the asterisk means. When you had that discussion in terms of the asterisk, put an asterisk on the allocation to Thurston Strong United Way, and we'll give the timeline of October 16th. We're hoping by October 16th, we're going to be able to resolve all those issues with the Department of Health. If at that time, we're not able to resolve what perhaps what I call the CONCON agreement, Comms to Public Health, with those restrictions, then we'll engage the board to perhaps come back from those decisions a little bit. And that's what the asterisk is important for me to highlight this morning, because it's depending on how we're going to be able to resolve that. Also the asterisk, and I don't know if that is going to be feasible in the next 2 weeks, whether the Congress can pass an additional CARES money that will allow local jurisdiction at least to extend the time of expenditures for another year. And also that asterisk give us that ability. But based on the conditions of the Congress right now, it will be unlikely that anything will happen in the next 2 weeks. I think they have other matters to worry about at this point. So that is really the suggestion, the recommendations from staff this morning related to the additional $1 million with the asterisk.
All right. Gary?
The only concern that I have is that we have adequate testing for the unknown that's coming in the future. That's my biggest bugaboo, having to do with kids and schools. I think kids are missing out big time by not attending in person. I know we're doing remote, but we need to make it safe if we're going to go in person. And I want to be able to make sure we're adequately equipped to do that. So that's it.
Okay. Ty?
Sorry, Jenica, I'm going to maybe ask you to repeat yourself because there's a lot we're taking in here. The program is allowing child care providers to get subsidies in order to be solvent while they take on fewer. And I mean, how can you describe the mechanism again, exactly how this program works?
We established that they have had COVID impacts, and so the grants go to the child care providers that could go towards rent, reconfiguration of their sites to allow for social distancing, PPE, cleaning, to a variety of different uses when we're able to establish COVID impacts.
Okay, so there's still the same screening that they have to connect the money they need to something that happened because of a COVID impact.
Mm-hmm.
And you feel, I'm sure you've been working with the Thurston Strong folks to feel that there's capacity there's a need, I guess, there's capacity to use this additional money in this way, over and beyond what's already been allocated.
We believe that there is a need within our contracts with Thurston Strong. If for some reason they do not need more funding in one area, they're able to flex it to another, which you had seen with the micro business grants flexing over to childcare in the past.
I see. Thank you.
The reports that I've seen, childcare is one of the biggest needs in the community. So I think the additional funding is a necessary and valuable use of the CRF money.
Yeah, I agree with that. So you need another thumbs up or down?
Thumbs up or not on the suggestion of the additional $1 million with an asterisk.
Yes. 2.
Thank
3.
you.
All right.
We'll keep you informed as we move along in terms of the rate of expenditure of this grant And you may be in the position to make yet other decisions as we move along down the road. Jenica, can you reach out to Tom Webster? He's negotiating with the contract with the Community Action Council to make sure they includes additional 170,000.
Definitely. Thank you.
Thank you.
Jenica, thank you very much. Shelley, thank you very much as well. And Robin, thank you very much.
And that's all I have.
Public testimony, nothing?
No, sir.
All right, and it's noon straight up. And any really hot button commissioner items that need to get out right away immediately? Mike can wait. Your time can wait. Gary?
No, I can wait as well.
Okay. Then this meeting is adjourned and we'll be back at 2 o'clock for our BoCC meeting. Thank you all.
Thank you.